initially they said, we're going to do surgery and you're going to be back to work because the tumor was small. It looked very contained. It's a simple surgery and you'll be back to work. So from going to, it's a simple surgery, you'll be back to work kind of 4 to 6 weeks, to give us a year.
All right. Hello, everyone. Welcome to episode 6 of The Mountains We Climb. In each episode, we will be diving into the mind of someone who has overcome significant challenge and adversity in their lives so that we as the listeners can see what is really possible and what it really takes. I'm your host, Jordan Kilpatrick Smith, and today we're going to be exploring one woman's fight with cancer and how she found the courage to ask for help. Kim, thank you so much for being here.
Hey, Jordan, thank you.
Just before we get started, everyone, I'd like to remind you that you can interact with us live by commenting in the comment section right below this live video, and then we'll be reading comments and questions live on the conversation. All right, housekeeping's out of the way. Kim, where does your story start?
Well, first I want to thank you for this opportunity. I feel quite humbled, actually. I really just a mere mortal. I haven't written a book or done a tour or anything, I think, spectacular, other than having an awesome family. But, I guess what I'm hoping is through this, it will help other people that may find themselves in the same situation, similar or whatever. I was I would say, living our best life. I was, like anybody, ups and downs, but health and exercise and living healthy really was part of our family's way of being. On my 56th birthday, after a funny episode with the propane barbecue and how you light a barbecue properly and not, I ended up with singed hair. So it went poof. And so you can't get that smell out of your out of my brain. So I had a shower, and that was when I found the lump in my breast. I wasn't worried because I think at 50, they start you doing regular mammograms. There's no family history of breast cancer. I haven't had any lumps. All my mammograms have been cleared. So I found the lump, but I wasn't really worried. And I knew that in about another 6 months, I would have my mammogram again. So, I'm thinking, well, do I just leave it and wait for 6 months? My husband and I were hoping to do some holidays. And we had downsized and looking at semi-retirement. So there was a lot of little fun projects on the go.
Right. But
then I thought, I'll just stew about it. So why not go to my doctor? So I went to my doctor, and like most movies, fast forward, everything happens. He sends me to the breast assessment center. I get a mammogram. The same day they give another mammogram. Then they send me for an ultrasound. And then they say, did you bring a support person with you? So, they can't tell you anything because they have to do a biopsy and send that report away. But it's looking, all of a sudden, Ed, who was waiting for me in the waiting room, who wasn't allowed to be back there because of women basically walking around without tops on, now they want him with me. So I knew, right? I knew something was up.
Yeah.
So on my 56th.
So can I just pause you for a second? When you knew something was up, right? So you had the the mammograms, and then you had the ultrasound, and they said, do you have a support person? Like, what went through your head in that moment?
Yes. I think it's normal to jump to worst case scenario. I think I have cancer. They haven't said anything, and what you're looking at are people's reactions to you, their expression, and they have kind, awesome people at these breast assessment centers. I can't say enough good things about them, and they're professional. But I know they saw cancer, because you're not getting a little bit more glib, like, well, don't worry, we'll send it away. Your doctor will give you a call, that kind of thing. When they said, do you have a support person? When they did the biopsy, and they did this all in the same day, that's the other clue. This is pretty rushed.
Yeah. And okay, so you think I have cancer, right? What does that feel like to have that thought?
That's a really good question. And I think it hits to part of the core for people with cancer or in pre-diagnosis is everything is a wait. So you have to wait for results to come back. You have to wait for your next doctor's appointment. You have to wait for them to have a tumor board meeting. And the waiting is very, very difficult. I would say, and this is one of the reasons I really appreciate this opportunity, is it affects your mental health. So the physical health component of my journey, I felt very confident. I had excellent people. I love my oncologist, the technicians, right from volunteers in a hospital. That went very, very well. It was the waiting. And sometimes, like I remember once my surgeon said, okay, I'm going to call you Friday at 1:00. They made an appointment for me. And this is 2 years prior to COVID. And she didn't call. I waited all day long. So you get up in the morning thinking, oh, good, my surgeon's going to call at 1:00. And they don't call at 1:30. And then at 2. And then at 2:30, you phone their office and you get their answering machine. And that's a Friday. So now that's the weekend. And I think for medical professionals, being cognizant of that wait and the stress that plays for cancer patients is really, really significant.
Yeah, well, you've just been told that you have this potentially life-threatening disease, and then it's like cliffhanger.
Yeah,
right?
yeah, right. And so what happened in my journey was, okay, I was out walking the dog in Algonquin Park. And so my family doctor gets the results. So I, as a patient, will get the results, right, of the biopsy. He got them. I really appreciate, he phoned me 6:00. So I know it's beyond his office hours. And he said, I can tell you the news right now, or I can see you on Friday. Well, I'm not waiting till Friday, And so I said, oh, please tell me now. And he told me you have invasive ductal carcinoma, which is one of the most common forms of breast cancer. But, I'm in Algonquin Park with my dog. Now, I love nature. Walking is good. And that's what I did a lot of in that waiting period was a lot of exercise, a lot of waiting. Distraction is key. But, that's suddenly your life has changed. One phone call. And although I felt that was what the news was going to be, it confirmed it. And that was really difficult.
And so in what way, this sounds kind of like a silly question, but in what way specifically was it difficult? So like to have that confirmed for you, what did that feel like?
It felt, yeah, that's a really good question. I think initially it felt like I was going to die. I think the worst fear with cancer is, I quickly leapt to, I'm going to die with this. Are my affairs in order? Funny story is, so before my surgery, I opted for a bilateral mastectomy. My husband and I, we went on a little vacation for distraction just before the surgery, just to take my mind off it. I called it my breast goodbye tour. So we just went on a tour through the mountains in New York. Anyways, we would be shopping and I would be thinking, well, I'm not going to buy anything for myself because I'm not going to be here in a month or 2 months,
Right.
And for a long time, I knew that was silly. I'm a mental health counselor. I knew I was having catastrophic thoughts. Why stop catastrophizing? Keep, and everyone tells you when you have cancer, be positive, eat well. Everybody has something for cancer, which I appreciate. I appreciate input from people. It's just, sometimes we have to be mindful of direction we give people, in those times. Sometimes it's better to listen than to offer help.
Yeah.
But anyways, I did think, who's going to take care of the kids? I mean, our kids are grown adults. Who's going to take care of my husband, my dog? You get all these terrible thoughts. And I would fight them for a long time until, when we get into this a little bit, when I did some of my own mental health journey, I realized sort of having that worst case scenario is not a bad thing. Just don't stay there.
Mhm.
So sometimes that helps you plan. You think, okay, what if I die? We're all going to die, and being able to talk about death is another one of my passions, because I think we just don't, because I don't know, it's like it would happen too soon if we talk about death. I don't know. So being able to talk about death, thinking about, okay, if I were to die next month, does everyone know my passwords to banking and to the internet? And, what do people need to know? And then move away from there. Feel confident. Okay, worst case scenario, you die, you've got things organized. Now just don't stay there. And that was the trick, not staying there.
Yeah. So faced with your own mortality, how did you not stay there? Like, what did you do to kind of pull yourself out of the whirlpool that is, right?
And that is, with cancer, it's a long journey, because initially they said, we're going to do surgery and you're going to be back to work, because the tumor was small. It looked very contained. It's a simple surgery, and you'll be back to work. And then, of course, what happens when they take the tumor out, they do a biopsy on it, and they didn't get clear margins, and it was an aggressive form of cancer, and it estrogen positive. I mean, you get all this. So again, you're back thrown in. So as I start to feel better, I feel better about my surgery, I'm feeling a little more confident. Now you're thrust into, I think we need to do chemo.
Right.
And then from chemo, they say, you know what, because we didn't get clear margins, we should do radiation. So
on top of chemo?
Yes. So my oncologist said, so from it's a simple surgery, you'll be back to work kind of 4 to 6 weeks, to give us a year. And a year is is a large time frame. And so I had to do chemo, then I had to do radiation, then I had to do, and then I'm on a hormone therapy now. So it took a long time to feel like myself again.
Yeah.
And the treatments, again, this is that, I felt so confident in the hospital. In fact, I felt reassured when I was in the hospital getting treatment. The nurses knew what they were doing and everything happened. But between that treatment, and they were every 3 weeks, my mental health would suffer. So I'd come home, you have 4 or 5 bad days from side effects, sleeping, fatigue, feeling really like bonking, like if you're working out and your body just breaks down.
Yeah.
You build up, but you start to, that's when my mind would start to really suffer. Like, is this ever going to get any better? Did they get it all? Is there still cancer inside? I had really great support, family and friends. I can't talk enough about how much they just made this journey so easy for me. I felt very, very supported. But there is a part of cancer where you don't want your family to have cancer too. It is nice to just be a family and talk about other things than cancer.
Yeah.
So I think that's when you start to internalize and you think about it more yourself and try not to project it, so that not everybody has to have cancer.
Yeah. So we try to take like the whole burden onto ourselves, right?
Yeah. Yes.
So
yes.
What was it that your family did that allowed them to give you such good support? And I ask so that if myself or any of the listeners have a family member with cancer, we know how to best support them.
Yes, that's really, really important. What really helped me was when my caregivers took care of themselves. So I didn't want people to feel like they can't live their lives. So for instance, our son was out west. There's no point in him coming home. I don't want people sitting around me, as much as people wanted to be helpful and saying like, I'll do whatever, So it was like, we've got it. Like my daughter was in university. We don't want her finishing her last year, like being at home with us. If what we had to as a family, and I think, is trust each other. we would let you know, we would tell, having those honest conversations, we would let you
Mhm.
know if people need to come home or if things aren't going well. And I think that honest conversation is not easy. And I think it's really important we have that. So that's how people know how best to support you. And it's okay to say, like, we all might be afraid I may die. We're all going to die. But we will not hide this from you. We will not try and make it rosier than it is,
Mhm.
and that I think is so. If I could then free them up, like I could say to my husband, it's okay to go play hockey. I want you to go play hockey. In fact, I want some time to myself. I want to be normal. I don't want to be a patient right now.
Yeah.
I'm okay. And he did. That was like the best gift he gave me,
Right.
because when I was not well, it was pretty obvious I wasn't well. And they, got me water when I needed it, or checked in and said, "How you doing?" or threw on some Netflix or something if I couldn't sleep, so they could tell. But I was so I really hope for caregivers that are out there, if they're hearing this, it's so important to take care of yourself too. I'm sure their loved one, whoever has cancer, wants. You're going to feel split. Like, I got to help my person with cancer, but I got to take care of myself. It's too much. But try to do a little.
Yeah. So what I'm hearing is they really showed up to listen, right?
Yes,
They were
yes,
listening to
yes.
you and what you needed, not what they thought you needed.
And, part of my, in our intro was, the courage to ask. My daughter shared a book by Amanda Palmer called The Joy of Asking, or something like that. Anyways, and it's about the importance of asking for help. I think we say, "I'm fine." If everyone will say, "Oh, you've got cancer. Is there anything I can do?" And then I would say, "Oh, no, no, thank you." But if there is a specific thing, ask it.
Yeah.
All someone can do is say, "I'm sorry, I can't do that." Or if someone said, "Can I bring you supper Friday?" Say, "Yes, thank you." There will be times to reciprocate these kinds of things. So I found asking for help. And I find in my day to day, I knew how to be busy and help others. To accept it was hard. It was very hard.
Yeah. Okay, so you got to the point where the doctor told you you have this breast cancer. They told you that, in and out, nice and quick. To it's an aggressive form of cancer. We didn't get good margins. You need to have chemo and radiation. Then you started to experience the side effects of these treatments, right?
Right.
And it was in the suffering of these side effects that mental health really started to decline, right? So can you tell me a bit more about what kinds of thoughts and mental challenges and barriers you were experiencing as you were going through these side effects?
Sure, sure. The I look at some of the barriers as external and internal. So external, one, I was a mental health counselor. So for me, I felt, how embarrassing is this that a mental health counselor has to go and see someone for mental health counseling or talk to the doctor about it, right?
Yeah.
And my doctor would make referrals to our agency. So, now it was the opposite end. I felt that was really that was hard. That was very hard for me personally, professionally. I felt that was hard. Um, so I had to spend some time processing it. Internally with mental health, what happened is I ignored it a lot. I kept saying, "Oh, it's a side effect of the medication." It was mostly anxiety for me. Depression around, maybe I will die or not. I'm pretty death positive, so that wasn't as much of a burden for me. Probably was there a little. The anxiety. So what I would do is try and pretend it wasn't happening. Avoidance
Mm-hmm.
and denial. And what happens when you continue to do that is you end up getting sick. And what is interesting is when I would go to treatment every 3 weeks, when you go for your next treatment, they give you a sheet and it asks you about your side effects. So let's say, are you nauseous and vomiting, blah, blah, blah. 2 questions. One says, do you have anxiety? And one, if you have depression, and it's a score of 1 to 10. And I remember scoring it higher and nobody asked me about it.
Right.
You know, and I guess I thought they have telepathy. They should know I am anxious, or maybe someone else will come to me and say it, and then I don't have to sort of admit it or something. You know, it was much easier to talk about cancer than it was about my mental health. It was much easier to talk about, you know, nausea than it was my heart rate feels like it's going through the roof.
Mm-hmm.
My chest is pounding. I have dizzy spells. You know, it was harder to talk about that because it's sort of in your head versus physical symptoms.
Yeah.
You know, if you break an arm, it's physical. You see it, you got a cast. When it's just in your head, it's hard. And I so feel humbled by so many of the clients that I've worked with that have dealt with mental health almost lifelong for some people. You know, I mean, the prevalence of mental health, I don't know, they say 20%, 25%. I think it's 100%. We never know what's going to happen to us in life that may put us into an episode of anxiety, depression, or a delayed diagnosis, or we were never diagnosed and we've just managed, we've hid it from everybody.
Yeah, absolutely. And I think you touched on a really important part of like the human psyche or experience, or however you want to describe that, in that if we have a broken arm, we almost like detach from it, right? And we look at it as if it's this external thing, like, okay, there is this broken arm. But when it's our mental health and it's anxious, it's I am anxious, right? And it becomes almost part of our identity, and it becomes so hard to show these skeletons in the closet as we view them, right? Because it's like there's something wrong with me.
Exactly. You know, I remember there was something, you know, one of those memes that said, you know, I am not my mental health. The same way I am not a broken arm. I have a broken arm.
Yeah.
I am not the broken arm. It is like, I am not anxiety. I struggle with anxiety, or I have, you know, panic attacks or whatever, but it's not who we are as a people.
Yeah.
We've got lots of components to us.
Yeah, absolutely. So just looking at comments for a quick second, Jacob says that he remembers going through this tough waiting period with his mother. So, you know, everyone has to go through this, and it's so unfortunate that there's this huge cliffhanger that everyone has to experience. Obviously, I'm not an oncologist or anywhere in that field, but I hope that one day that doesn't have to be the case.
And I really found if we can be more, it's not just client-centered or patient-centered, but patient included. You know, now with COVID, like now with electronic tools, you can go in and see your results. So blood work. So before my doctor talked to me about my blood work, I could go in and see my blood work. And that was empowering. It's not scary. And it wasn't like, uh-oh, I'm going to Google it and think I have some other cancer.
Yeah.
It was like, oh, this is good news. My hemoglobin is up. Or it was, oh yeah, that's why I've been so tired. My hemoglobin is down.
Right.
Information is power. The waiting, where it only has to be a doctor that tells you, yes, I'm hoping we can work on that a little bit.
Yeah. Chris says that's so profound that it's easier to talk about the physical cancer than it is to talk about the mental health aspects of cancer. And I think that when we talk about cancer, we never talk about the mental health side of the cancer, right? It's just, you know, you got cancer in some physical area.
And it's sort of a given. We overuse the words, probably anxiety, depression, and all that kind of stuff now. And so, you know, for me, I thought, I can't live like this. Like it became a point when you asked that question, you know, how did it look like for you? So you sort of put it off, try and, you know, use some tools. And then I realized I think I need to speak to the doctor about it. I'm not a pill person, so I don't like to use medication. My cancer journey, I've had to embrace medication because that's how they're going to get to the cancer or stop the nausea or whatever. So I'm mindful of the medication, and I like to be knowledgeable, but I also don't want to not pursue that to see if there's something that can be helpful.
Yeah.
And maybe it's permanent, maybe it's temporary. I don't want, everyone's worried about, addiction to medication and things. And I'm one of them. I'm very conscious of it. I have in my in working, seeing where medication has really played an important role. And I think it's a combination of good tools like exercise, eating well, being mindful, meditation, yoga. Yoga is one of those. I hated yoga. I can't even admit that. And I hate because it was too slow. I'm a go, go, go.
Yeah.
And then I realized I need to be still. I need to learn how to be still and not go, go, go. And breathing with yoga. So I live in a small town. This is the other combination of sort of challenges, is very rural. There are no support groups in our community. We had just moved there. I didn't know anybody else with breast cancer in my community. I did have a friend with breast cancer, so I reached out to her. But no yoga classes, no gym per se, nothing. So my regular tools were sort of gone. So I just looked at an app on yoga and started doing some of the breathing. And what I had to do was bite things off in small chunks. So it wasn't like, hey, I'm going to become a yoga teacher, or I'm going to do yoga an hour a day. It was like, okay, twice a week, maybe I will do 15 minutes of yoga. And
Right.
even if it's child's pose and breathing, that started to help with my mental health. It was, it's true what they say. It's just, you have to just start it. You have to, I remember a client saying to the psychiatrist when we were in a session, he said, where's a pill for motivation? Like you can give me, you can give me a pill for my anxiety or my manic thoughts, and I know from what I need to do, but how do I do it? How do I do that? And he said, think of the Nike ad, just do it. Don't have to jump off and into, you don't know how to swim. You don't jump into the deep end. You might sit at the edge of the pool. You dangle your feet in the water. You might do that for a little bit. Maybe it's a whole year you're going to do that. But you start to, I think we mentioned, when I listened to your other podcast with Chris about yoga tapas. So if part of a tapa for you is like a covenant of something, like you're going to take care of your mental health, you just need to do something and incorporate it that means something to you in your everyday life.
Yeah.
So I had to speak to my doctor about my what options were for medication, because I could not, it had gotten so bad, I'd let it get out of control. And
Sorry, the mental health?
Yes, the mental health.
Okay.
And I guess, and I don't know other people would even recognize it. It's just like, it would be at nighttime, just this panic feeling. Sometimes during the day, it could happen at any point. And it wasn't just short episodes. It would just go on. And I might try some distraction and it alleviated a little bit, but it still came back.
So,
yeah.
Anxiety is what I'm hearing was the largest mental health challenge, right? And then, so if you were very death positive, very conscious of that. So can you think back and do you recognize the thoughts that were causing these panics and these anxieties for you?
Yeah, that is a weird thing for me about anxiety. If I was having thoughts about dying or my cancer returning or spreading, that anxiety would make sense to me.
Right.
But I wasn't having those thoughts. And that's why it was hard for me. It was like, it would just, I'd get up, beautiful day, I'd have some things to do, and then anxiety would sit in. And I wouldn't have had a negative thought in my, so that I was conscious of anyways. Maybe it was subconsciously the cancer, and I don't feel like myself, and I have cancer, and what does that really mean? So there might have been some subconscious kind of play in there. That's where it made it harder to ask for help, because I wasn't recognizing it, because I wasn't having, early on I had all of those catastrophizing thoughts, but not later on when the anxiety really kicked in. And I think it was the persistent little bit of anxiety that I ignored.
Right.
I just pushed it down, pushed it down, pushed it down, and kept myself busy and didn't talk about it so much. And I think that just built to be this, I call it like a beast within me kind of thing that just, eventually said, nah, we're not, the body says no. You're, your heart's going to keep racing like this unless you do something about this.
Right. And so what did you do?
So I did talk to my doctor and asked about what medications there would be options for. And I also then started to, we had a discussion about, what was preventing me from trying some good, healthy tools that I have in my toolbox. First off, it's really important. He was not shocked that I was there, or, thinking, wow, you're a terrible professional that you have to be here, right?
Yeah.
So I had built that up. And of course, he was very sympathetic. And I think, the more we talk about it, to realize more other people suffer from it too. Doctors have mental health issues too, nurses, everybody. It's not like, you're immune and you're weak because you do. So I think that's reassuring. So I was received really well. He was very positive. He said, let's try a low dose of a medication that might help the anxiety. Who knows? I said, I'm going to try yoga twice a week, just slow yoga. I'm going to try, my fitness had really sort of fallen apart from all of the treatment. So I was going to make a more conscientious effort to get treatment or to get exercise. And the other thing that was lacking was connection. And because I have no groups here, I went to the Cancer Society, and they have online community groups. And I thought, oh, I don't know if this is for me or not, but let me try.